A lot of Americans look abroad because healthcare in the U.S. feels exhausting. The bills, the deductibles, the networks, the confusion, the feeling that one medical event could damage years of careful planning. So when people hear that doctor visits, prescriptions, dental work, and lab tests can be much cheaper abroad, it feels like relief. And sometimes it really is. But here's the part that can change everything. Cheaper healthcare does not automatically mean you have a real healthcare plan. And for retirees, that distinction matters. A country can have excellent doctors and still be the wrong medical fit for you. That's the mistake many Americans make before moving abroad. They ask, is healthcare cheaper there? But the better question is, if something serious happens to me, do I know exactly what I would do? Because routine healthcare and serious healthcare are not the same thing. A $40 doctor visit is wonderful. A low-cost dental cleaning is wonderful. Affordable blood work is wonderful. But what about a heart event, cancer treatment, a hip replacement, a stroke, dementia care, long-term assisted living, emergency evacuation? Those are the questions that determine whether a country is medically livable for you. Not just affordable, livable. Here's the thing. In many countries popular with Americans, routine care can be refreshingly simple. You may be able to see a doctor quickly, pay cash, get labs done without drama, buy prescriptions for less, get dental work at a fraction of U.S. prices. And for people who have spent years fighting the American healthcare system, that can feel almost emotional. It can feel like dignity, like being treated as a patient instead of a billing code. That's real, and we shouldn't dismiss it. But this is where people get caught off guard. The care that feels easy when you're healthy may not feel simple when you're scared, when you're in pain, when you don't speak the language well, when you need a specialist, when your spouse is trying to explain your medical history, when the hospital wants payment up front, when you're wondering whether to stay abroad or fly back to the U.S. That's when the fantasy version of healthcare abroad disappears, and the real plan has to take over. So let's start with the biggest misconception. Medicare is not your international health plan. For most Americans, Medicare coverage outside the United States is very limited. That means if your plan is, I'll just use Medicare if something happens, you may not have the protection you think you have. Now, some people keep Medicare while living abroad because they may return to the U.S. later. Some people also buy private international insurance. Some rely on local private insurance. Some self-pay for routine care. Some plan to return to the U.S. for major procedures. But the key word is plan, not assumption, not hope, not I'll figure it out. Because when health is involved, figuring it out during a crisis is exactly what you want to avoid. And this is where age matters. If you're 35, healthy, working remotely, and living abroad for a few years, your healthcare calculation may be very different. But if you're 62, 68, or 74, your plan needs to be more serious. You need to know whether you can qualify for private insurance, whether there are age cutoffs, whether pre-existing conditions are excluded, whether premiums rise sharply, whether certain treatments are covered, whether emergency care is cash-based, whether your policy includes evacuation, whether the best hospital is actually nearby. And this is one of those unglamorous details that matters a lot. Distance to care. A beautiful mountain town may be peaceful. A beach town may feel like paradise. A charming colonial city may be affordable and walkable. But where is the best hospital? Where are the specialists? Where is the cardiologist? Where is the cancer center? Where is the English-speaking clinic? And how would you get there in an emergency? People love to compare countries, but healthcare is often city-specific, sometimes even neighborhood-specific. Living 2 hours from excellent care is not the same as living 15 minutes from it, especially as you get older. That doesn't mean you need to live next to a hospital, but you should not be surprised by where the real care is. Now let's talk about medications. This is one of those quiet details that can become a major headache. You may not be able to get the exact same brand. Your dosage may be different. The medication may have a different name. A substitute may exist, but your body may not respond the same way. Some prescriptions may be easier to get, others may be harder. And if you take multiple medications, you need to verify availability before you move, not after. Bring the generic names, bring documentation, talk to doctors, ask pharmacists. Understand what can be purchased locally and what may require planning, because nothing makes a new country feel stressful faster than running low on a medication you assumed would be easy to replace. Here's another point nobody likes to think about. What if you need help long term? Not just a doctor visit, help with daily life, with bathing, with meals, with memory, with mobility, with recovery after surgery. Some countries have affordable domestic help. Some have family-centered care cultures. Some have excellent private options in major cities. But long-term care, as Americans understand it, may not work the same way. And if your plan is to age abroad, not just travel abroad, this matters. A country that is wonderful at 62 may feel different at 82. That doesn't mean don't go. It means plan for the older version of yourself too, because future you deserves a vote. Now, this is where couples need to be honest. One spouse may have more medical risk than the other. One person may be comfortable with local hospitals. The other may only feel safe returning to the US. One person may say, healthcare is great there. The other may say, but what happens if something goes wrong? That conversation needs to happen before the move, not in a hospital waiting room. And honestly, the healthcare conversation is not just about medicine. It's about peace of mind. If you feel medically safe, you relax, you explore, you settle in, you build routines. But if you feel medically vulnerable, even a beautiful country can feel fragile. You may start avoiding travel, avoiding remote areas, avoiding activities, worrying about every symptom, and that defeats the purpose of moving abroad for a better life. So what does a real healthcare plan look like? First, identify your likely healthcare needs, not the needs of a generic expat. Your needs, your age, your conditions, your medications, your family history, your mobility, your comfort level with uncertainty. Second, research the city, not just the country. Where are the hospitals? Where are the specialists? Are there English-speaking doctors? How do emergencies work? What do expats with similar health needs actually do? Third, understand insurance. Can you get local private insurance, international insurance, travel medical coverage, evacuation coverage? What is excluded? What happens after a certain age? What happens with pre-existing conditions? Fourth, decide your U.S. connection. Will you keep Medicare? Will you return to the U.S. for major care? Can you afford flights back? Do you have a place to stay? Do you have someone who can help you? Fifth, test the system before you depend on it. On an exploratory visit, don't just tour beaches and cafes. Visit hospitals, find clinics, talk to pharmacists, schedule a routine appointment if possible. See how it feels. Because the goal is not to prove that healthcare is cheaper abroad. The goal is to know whether you trust your plan. Now let's be fair. Healthcare abroad can be one of the biggest benefits of relocating. Many Americans report feeling relieved by lower prices, less bureaucracy, and more direct access to care. In some places, private hospitals are modern, doctors are well-trained, and service can be excellent. This is not a scare video, it's a preparation video. Because the people who do best abroad are not the ones who assume everything will work. They're the ones who verify. They know where they'll go. They know how they'll pay. They know what insurance does and does not cover. They know whether they would stay abroad or return home. They know the plan before the crisis. And that is what creates freedom, not denial, preparation. So before you choose a country because healthcare is cheaper, ask, can I get insured? Can I get my medications? Can I reach serious care quickly? Can I communicate in a medical setting? Can I handle upfront payments? Can I return to the US if needed? Can my spouse navigate this if I can? And does this plan still work 10 years from now? Because moving abroad can give you a better life, but only if your healthcare plan is strong enough to support that life. The cheapest doctor visit in the world does not matter if you don't know what happens during the serious moments. And those serious moments are exactly where planning matters most. So here's my question for you. Would you feel comfortable relying on healthcare abroad for major treatment? Or would you want a plan that lets you return to the US if something serious happens? Tell me in the comments. because this is one of the most important decisions future expats need to make. If you're thinking seriously about life abroad, the cost, the healthcare, the safety, the visas, and what day-to-day life actually feels like, this channel is here to help you make a smarter decision. So if you want more honest, practical videos about living better for less outside the US, hit like, subscribe, and I'll see you in the next one.